Hello, this is Angelia, and you're listening to or watching the podcast, Why You Do What You Do. The podcast that talks about human development and psychology to maybe help you figure out a little bit more about why you do what you do. And we have been talking about, assessment techniques that your therapist might use to help you figure out what's going on here. My glasses is fogging up. And we're gonna continue with that. When we're talking about the diagnostic criteria and things listed, in the manual, it's not just that simple, A few cases ever match perfectly. And that's why there's interviews and things, because they're trying to get a feel for who you are and what's going on. Therefore, the clinician must also rely on personal judgments of how the clients respond. And that's why you have to go through all of that schooling. Because, not only is your DSM going to help you, but you're also going to have to learn about the different types and different ways things manifest and different variations because, one size does not fit all. And you have to know what you're doing and all your knowledge that you need to know for, this behavior could mean this, but it also could mean this, or it could just be that this is going on right now. So, This involves interpretations of the client's behavior. That's your teller right there. That's how anyone who studies psychology knows you can say anything in the world you want to say. And say, things on one level that are just not even true with what's real. Your behavior is the teller. How you behave. You can say anything you want. You can say everything, but the behavior is what tells. That's something a lot of people in this country need to learn. Because there are people who are in charge of different areas in places who say anything. They'll just say, yeah. But then their behavior does not back that up. So the behavior is what is the teller there. Like I say, people lie. People going to tell you anything you want to hear sometimes. To get your vote, to get your money, whatever. But it's how you behave that tells the story, as the saying goes. This involves interpretation of the client's behavior. Like I said, your behavior is the teller. You can say anything you want. It's how you behave that tells people what they need to know, if they know to look. This process generally begins with a rather lengthy interview. And if you've ever been to therapy, you know that. They want to know your life story. And usually when first time you go to a new doctor, they want to know your life story. So, that's nothing that shouldn't be unexpected. Let's see. The completeness of the DSM's listings should help mitigate the process, because the DSM is basically an outline and it gives you ideas for what's going on with this person. But again, like I say, one size does not fit all. They might be behaving a certain way because of this other thing. Or it could be something in their background that they developed a coping mechanism that looks like this. So, one size does not fit all. During the psychological interview, the psychologist or the counselor tries to get a maximum amount of data about the client. Like I said, they want to know your life story as much as you can tell them. Certainly, you can't sit there in the first session and tell your whole life story. But there are people who want to do that. I've had clients who that's what they want to do, and you're like, I gotta go. It's been an hour. We said 45 minutes. Been an hour. Gotta go. So, some people have a lot to unpack. From there, the client may be asked to take a psychological test. And like I've said before, don't be afraid of that. those are to help them figure out what is going on with you, of which there are several types. Many college students may be familiar with the type that evaluates a person's career interests and aptitudes. And they give those in middle school now, My kids took a test like that in middle school, and it's like, why are middle school children having to figure out what they're going to do with the rest of their life? That's crazy. The psychological tests most often used, to diagnose abnormal behavior fall into 3 categories. Number 1, personality tests. Number 2, intelligence tests. And number 3, tests for neurological impairments. Sometimes the clinician will also request a full psychological examination. And again, they're just doing this to try and figure out what's going on with you. It's like I say, people scared if they go to therapy, they're going to end up in a mental institution. Hardly ever happens. I mean, a very small amount of people that go to therapy in a mental institution. I mean, they were like, when I was working at the psychology group and the counseling center, I think we had 2 clients total in both places that ended up in a mental institution. The rest of these people came for therapy every week or 2 weeks or whatever, and eventually were exited, from therapy. So it's nothing to be scared of, If you think you have a mental health issue, go. It's only going to behoove you to go and get that cleared up so that you can be the best you can be. The initial interview. The initial interview is probably the oldest and the most widely used assessment technique, because remember Freud used that, and still a very valuable one. We do different things with it nowadays than Freud did, but it is basically a conversation with a purpose, ascertaining the problem. That's why they're asking you these questions. When I would sit down with life coaching clients, that's the first thing I did. I asked them questions. And that's how you start to figure out, you get a picture of what's going on with this person. The interview can be structured following a, tested format of specific questions asked in a certain order with guidelines for rating the person's responses. And that's usually how it's done. I had a questionnaire that I made after working at the psychology group and counseling center and doing support groups. I came up with my own, questionnaire system to kind of lead me in several different directions to where, I could help this person. Or if their problems were bigger than I could handle and they needed to be referred to a, licensed psychological professional, because some people did. The interview can be structured following a tested format or specific questions asked in certain order with guidelines for rating the person's responses, or it can be unstructured, as is usually the case. Usually you just go in there, you talk with them, and it's a casual thing. In an unstructured interview, the clinician may simply ask questions spontaneously, or perhaps let the client do most of the talking. And that's what I usually did. I would make notes, but usually I let them do most of the talking, because that's why they're there. They want to tell you what's going on. Under the assumption that important points will surface naturally if the client takes the lead. And that's usually true. But you do have some clients who decide they're not going to tell you things. And I don't understand why these people bother to go to a mental health professional if they're just going to block the whole time and not talk to you about what's wrong. Because, it's like, well, I understand it. It's your money, but if it were me, I'd be wanting to tell my therapist exactly what's wrong so I could get well. I wouldn't want to block in therapy. And usually that comes from having controlling influences growing up, to where you don't want to give any of your autonomy or your self away And sometimes that has to be overcome before the person can actually get help. Some clinicians may follow a set format of questioning that they have devised themselves, a sort of semi-structured interview. And really the best way is to be flexible on that. To, have the structured if that is helpful for the client, or to be more unstructured if that is helpful to the client. Because everyone's different, and everyone has a different way they like to, interact. Some people want the casual, some people want the more clinical. You have to figure out which your client is, and the best way that you can help them. Structured formats do seem to improve interjudge reliability, meaning that it can jive more with what other people are thinking or saying, or with your DSM. There are 3 types of interviews: intake, case history, and therapeutic. An intake interview is an initial meeting between client and therapist. Its purpose being to find out the client's immediate history, that is, what led to the appointment. And so many people, I just don't understand. What's going on? Oh, nothing much. Well, what are you having? I don't know. It's like, no. You made the appointment. You need to be forthcoming. Because if you're not, you're only hurting yourself. You are not going to get well if you don't purge the illness. It's like your body. You get sick, your body develops a fever to purge the illness, to kill the illness. Okay? So when you go to therapy, it's your job to tell exactly what's going on so you can purge this illness. If you're holding it in, then you're keeping yourself sick and full of illness. So, it only behooves you to be honest and to be forthcoming with your mental health professional. Case history interviews work toward getting a picture of the person's lifespan. And that's when they start asking you, how was your relationship with your parents? How was, your family? How was it coming up in your neighborhood, school, whatever? Because all these things kind of go into making you who you are, which goes into making how you look at things, how you interact with others, and colors the way you think about things. So that all comes into play. The clinician tries to get an overview of the distant as well as the recent past, because that's going to help them figure out what's going on. Therapeutic interviews are the periodic treatment sessions that are subsequently scheduled to try and root out the problem. Like I said, most people come once a week, once every 2 weeks, once a month, and, unfortunately there are people who become addicted to therapy. They want to come, every other day, all the time, and it's like, I understand you got someone to talk to now and it's helping, but sometimes you have to set boundaries with your clients, because they want to insert themselves into your life. It's like, no, we have a professional relationship. You can't call me off hours. You can't, be texting me on holidays. You can't be, inserting yourself into my life. Not cool. There's a professional boundary there. And some people don't like that and they get upset, but you don't want your clients to be dependent on you. You want them to become independent. That's the goal. The interview is usually conducted with just the therapist and the client present. Sometimes another member of the client's family may join in, especially if the client is a child. Now, sometimes people want to bring a friend or a family member because they're scared. And they're scared of what's going to happen, and they want this other person to advocate for them. And that's usually a person who's a dependent type personality, or who has been, abused or used in some way to where they don't feel comfortable being alone with someone in a closed door room. And that's perfectly fine. In my opinion, that's perfectly fine. The therapist will try to get as much information as possible in one session, but often one or more sessions are necessary before the diagnosis can be made. And sometimes you might go for, a month or 2 or 3 or 4 before the diagnosis can be made. It all depends on how much you're willing to tell the therapist and, work on yourself, because sometimes people, like I say, they come to the appointment, but then they don't want to tell you anything. They don't want to divulge. And you're just thinking, you're wasting both our time here. It's no skin off my nose, but it's skin off your nose because you're supposedly here to get well, but you're not making any effort to get well. So why are you bothering, The information that the psychologist asks for is covered in the following list. Number 1, identifying data. Your name, your age, your sex, your marital status. That's just to give them a picture of, your basics. Number 2, present problems. The problematic behavior. And again, it's your behaviors that's problematic. Like I said, anybody can say or do anything. It's your behavior that tells people, what's going on. And a lot of times people have problem behaviors. And if this is a problem in your life, you need to take responsibility for your own behavior. And take some steps towards making those behaviors to where they are not harmful to you or others. Number 3, family history, relationships with family members, and any history of physical or mental illnesses. And that will also include abuse. If you were abused in any way, and how that has affected you coming up in your life. Because unfortunately, the world can be a bad place, and those things are going to scar you and form, bad habits, ways of thinking that aren't, exactly healthy for you. I knew a girl who was cutting and, doing destructive things, and unfortunately, especially if it starts when you're a child, that is going to just mess up your whole world. Education, highest level attained, and that's not, them being snobby or whatever. That is to help them know how to relate to you. Like if you're an average Joe, I'm not going to talk to you about your suprachiasmatic nucleus, whereas if you were a psychologist, I would talk to you about that. But, I would say, do you wake up regular? Do you sleep regular? How are your, cycles? Whereas, like I said, with a psychologist, I might talk about, how's it going with your circadian rhythms? Is your suprachiasmatic nucleus okay and on track and everything? So, it's to tell you where the person is and how you need to speak to them, because like my mother-in-law says, if you're using $5 words, then they're not going to understand what you're saying. But medical history, present and past states of health, occupational record, career stability and your interests, sexual history, kind of frequency of intimate relationships. And I'm just going to put this out there for any of you therapists out there. There's many therapists watching. But if you are, just because someone says they're sexually active doesn't mean they're screwing around with a bunch of people. I had a doctor one time and asked if I was sexually active, and I said yes. And they were like, oh, okay, well, we need to get you AIDS tested and check for STDs and all. I'm like, ho, wait a minute. I have a husband. I'm not screwing everybody in the world. And they were like, oh, well, to me, sexually active means, you're... And I'm like, no, you just asked, was I sexually active? I do have sex upon occasion. It doesn't mean I'm out screwing whatever and whoever. So yeah, if you ask, are you sexually active, most people just think that means, are you doing it? So you might want to be a little specific. If you want to know if they have more than one partner, ask that question. Do you have more than one sex partner? And you'll get a better answer to that. Social relations, quality, and number of friendships. That is a big teller of people. People who can maintain friendships. If you have a problem maintaining friendships, that's a pretty big teller of how you are with relationships. Because it's like back to one of my former clients who everyone else was the problem. Everyone else around her was the problem. But she could not maintain a relationship. She had bipolar. She was aggressive with people. She said things that she should not have said. She was a little bit paranoid, and so she assumed people were out to get her, or saying stuff about her, or whatever, or going behind her back. And it's like, I gave her some reality. She did not like it. She panicked and said, "I'm gonna have to go to a therapist now." And she's like, "Do you have liability insurance?" And at the time, I didn't. I had just left the place and hadn't got. And I said no, because I could tell what she wanted to do is what she'd done to her previous therapist, which was sue them because she didn't like what they had to say. And there are people like that, unfortunately, in the world. And usually they are the people who have the most problems. And someone shared a little meme that said that psychologists say that people who need therapy don't come to therapy, their victims do. And so sometimes the people who really need the most help are unwilling to help themselves. They're all too willing to blame everybody else around them. It's all everybody else's fault. But somehow they don't ever see that it's their own behavior. And I never had a problem making friends. I'm a friendly person. I like people, and I talk to people, and I don't have any problems making friends. And if somebody says something off color, I'm like, hey, I usually give people a lot of chances before I say, you know what, this is too much aggravation in my life. I'm not doing this anymore. So, if you have problems making and keeping friends, that's a problem. Just so you know. If the client is a child, the clinician will ask the parent about the child's developmental history. For example, if the formative physical and social growth stages were unusually rough for the child. Because, how the medical doctor asks, did they walk on time, eat on time, speak on time, whatever. The mental health professional is going to want to know how their behavior was at a certain stage. How did this affect them? How did the divorce affect them? How did, this traumatic event affect them? How did this death affect them? So it's similar that the MD, the pediatrician, is going to do. So, as we mentioned earlier, a structured interview has been shown to be of great help in obtaining the initial diagnosis and securing interjudge reliability. Such formats list specific questions in set sequence and give precise ratings for the answers. And like I said, I had my own little questionnaires that I made for my coaching practice, and they were kind of based on, things that the other businesses were doing, but I kind of put my own little spin on them because I'm looking to help people specifically. I'm not looking to diagnose people. As a life coach, I'm looking to help you to live your best life. So, that's the approach I took to it. The examples are the brief psychiatric rating scale and the current and past psychopathology scales. The latter, which was developed by Spitzer and Endicott in 1971, so that was a while back, has even been adapted for use with computers. And a lot of those are like that now. You can they sit you in front of a computer or laptop, pull up the test, and you take it and you enter it, and then, the computer program can grade it for you. And that makes it a lot easier. When I worked at the counseling center, I used to have to grade psych tests, and then type out the report. So that was a lot of work. Observation. While the question and answer sessions is in progress, or while the person is being tested, the psychologist also tries to glean clues from observations of how the client behaves during the interview. Because, like I said, your behavior is the big teller. You can say anything in the world, but the way you're acting tells a lot more than what you're saying. You know, I knew a person who, they were a great actor. But the way they acted, the way they behaved, you know, they would tell you anything in the world. But the way they behaved showed the truth of the matter, which was they were not that great a person. So, the questions asked in the interview elicit information about the past and present. The behavior exhibited by the client while in the clinician's office directly reflects the present. A sloppy appearance, and you know, some people just are naturally, but there are some people, you know, I had a person that I got close to, and they smelled bad. They smelled bad, and it's like, that's a problem. You know, you don't want to say to people, dude, you need a shower. But incoherent speech. Now, for me, that might be a problem. If a therapist, you know, comes to me and is like, because, you know, I had that stroke and it affected the speech center of my brain, as most of you know. So, you know, some of my speech might sound incoherent to some people, but, you know, I usually get to the point I'm trying to make. Or extreme sadness or nervousness. And again, there are some people whose anxiety is off the charts, and like I said, I am not a super liker of anxiety-ridden people. I mean, I know they can't help it. I know there are things, but other people's anxiety causes me stress. You know, I'm like, why are you, you know, freaking out about this? Because you just need to deal with it. You know, and why are you worried about this? This hasn't happened. You know, you're making up scenarios in your head that they're freaking you out, and there's no reason for that. So, you know, I'm just more naturally a calm person. So, to me, ramping up everything it's like I tell my husband sometimes, not everything is a 5-alarm fire. Because it's not. Not everything needs to go from 0 to 100, because it don't. So, for example, it's indicative of the kind of problem afflicting the individual. So, you know, they're looking to see how you behave, how you talk, how you act, you know, to see what you're telling folks. In a way, the interview is a form of situational observation. The clinician can look at the entire interview session as a test to which the person responds. Therefore, the behavior exhibited during the session is just as important as the answers to the interview questions or to any tests that may be given. In fact, it's probably more so. Because like I said, people can say anything they want to say, but it's the behavior that tells you, you know. The clinician can also exert different degrees of control over this situation by determining the setting. There are 3 basic settings. Natural, the clinician and the client sit down together and discuss the important points. That's how most all of them are. Some clinicians have the client's family present as well, especially if it's a child, feeling that their interactions may have a bearing on the client's problem, because they want to see how there's interacting going on. Contrive, the clinician exerts more control in the situation by setting up a specific environment in which the client responds. This is the basis for play therapy, in which children are put in a toy-filled room and their actions are observed. And then the laboratory, obviously this is the most controlled setting, and this is if you were to check into, you know, a mental health facility, and then it would be a clinical setting, and it would be more like a laboratory setting where they would be evaluating you. The clinician can also call on others to help for observation. Parents of a child, for instance, can be asked to observe the child's behavior in specific situations at home. And that might be asked, when does she do this? When does he do that? Let me know how many times they do this. The client themselves can be requested to keep track of all their different actions and feelings for a specified period of time. And that's why I recommend journaling. Because if they start to see what they're doing, then it can help them undo these things. All such reports add to the psychologist's own observations and help determine the diagnosis. So again, all that stuff they had to learn for all them years comes into play. When the session is over, most interviewers will generally try to analyze their own reactions to the clients. And that's just occupational hazard, You try to think, well, did I say anything that might have, put them off, or did I say anything that might have led them a certain way that maybe we shouldn't have gone? Did they establish rapport, or was there an undercurrent of hostility? And like I said, most of my clients, we had great rapport. Like I said, I have clients and students who still, on my social media, but sometimes I can think of, out of 180, almost 190 some of my clients I had, there's like 3 that stand out in my mind as hostile folks. And like I said, you just wonder, why are you coming? Why? Why are you bothering? Because you're clearly blocking. You don't really want to get well. You just want to gripe, about everyone else. And I understand that's helpful too. But you could do that with, a buddy at the bar or whatever. So, that's not necessary to pay me to listen to you gripe. If that's all you want to do, just find somebody to gripe to. But if you want to get well, then, you need to take the steps, unpack your bags, so to speak, take out your garbage, so that you can put healthier things in there, healthier ways of being, healthier ways of doing. Like the saying goes, when you know better, when you learn better, you can do better. Psychological tests. Like interviews, psychological tests are designed to analyze a small sample of the client's behavior and attitudes. And yeah, like I said, the behavior tells all, and attitudes can tell you some things too, because there are some folks, I've met some folks with some pretty serious attitudes. I'm a little saucy, but generally, I'm pretty harmless. If someone's got a whole lot of attitude, you got the big chips on the shoulders, as the saying goes, my dad used to use, then that is telling you something right there. Also, like interviews, some are quite structured and others are less so. Again, it depends on the setting, it depends on the individual clinician and how they feel like you want to go forward with this, healing. Intelligence tests, for example, are specifically formulated to show the degree of deviation that a person exhibits from certain norms. Like you have the average, I think the average IQ was listed at 99 last time I read the data on that. So I fall to this side of it at 135. I know a man who's at 136, and I had an uncle who was up at 144. So, but I know other people who fall to this side of it. So, again, one size doesn't fit all. And, there are people who are of below average intelligence who live perfectly happy, perfectly well-adjusted lives. So, these folks I know who are intelligence snobs, just because you're smarter doesn't mean you're any happier. Personality tests, on the other hand, ask the client to respond to more subjective stimuli. And that's usually where you get the questions like, in this situation, what would you do? And they give you these 3 or 4 choices, multiple choices, like, Sandy stole your purse and it was her. What are you going to do? But your boss says they're not going to do anything about it. What are you going to do? Your choices could be you'll hit Sandy in the face. You're going to steal your purse back from her and then steal hers too. You're going to tell the boss that and try to prove your case. Or you're just going to walk away and let it go. Most people, are going to do the one that makes the most sense, which would be, tell your boss you saw her with it and try to prove your case. Because, the other choices are a little maladjusted. But, I digress. So... Anyway, that is some of the ways that the classifications and assessments are used in, mental health. So I hope that helped you figure out maybe a little bit more about why you do what you do. And I'm going to leave you there today. Thanks for watching or listening. Please like and share this educational program. And it is an educational program. It's not designed to diagnose or treat any mental health issues. If anything I said triggered you or you feel like it's a problem in your life, by all means, please go and talk to your mental health professional. Please share it so we can spread it around the world. If you want to help me out, subscribe to my YouTube channel. If you want to help me out even more, go to my Patreon page and become a patron. The link to that is in my posts. Thanks for watching or listening. That's all for now. Until next time.